they cannot give up hope. There is life after spinal cord injury.
I'm looking forward to 100% health back.
Stroke has become very, very common in Jamaica, and so a facility like this is really making an impact.
New limb, new life.
The Sir John Golding Rehabilitation Centre, nestled in rural St. Andrew, has been a haven for over 7 decades. Formerly known as the Mona Rehabilitation Centre, this life-changing facility was established in October 1954 as an urgent response to the deadly polio virus outbreak in Jamaica. The centre served as the only public facility in Jamaica and the English-speaking Caribbean that catered to rehabilitating patients afflicted with the virus.
In 1952, there was a polio outbreak in Jamaica, and there was a second one in 1954. So Professor Golding, who is an orthopaedic surgeon, he came to Jamaica in order to rehabilitate the many children who were affected by poliomyelitis. I would describe Sir John Golding Rehab Centre as a place of hope, a place where persons get a second chance. They get to reinvent themselves after a traumatic injury that renders them disabled, physically disabled.
The main goals of the Sir John Golding Rehabilitation Centre is to ensure that persons get the best possible outcome from the rehabilitation services provided here.
Sir John Golding Rehabilitation Centre offers a path for recovery and renewal with high quality and accessible services.
So the rehabilitation services here presently are more geared towards persons with mobility disorders. That covers, for example, persons with spinal cord injuries, which are sustained primarily from motor vehicle accidents. Even though the driver may die, you never hear of the 5 or 6 passengers who are injured. And unfortunately, some of them may as we understand, they may break their neck or break their back. But what that means medically is that they become paralyzed. So they are unable to move their limbs. Most times they have limited movement in their upper limbs, as well as sometimes no movement in their lower limbs. And the center provides hope for rehabilitation for them to get back out into society in as best as possible. We also rehabilitate persons with stroke. We also rehabilitate persons with, children mostly with cerebral palsy who have some mobility disorders. There are varying degrees of severities of cerebral palsy. So we would not be able to support children who are unable to do anything at all. We treat children who have some stiffness in, for example, their legs and have difficulty walking, and with physiotherapy and other modalities, we get them to function better.
This journey to recovery is supported by a well-trained and dedicated nursing team, providing essential care to ensure each patient feels safe, supported, and empowered every step of the way.
Working here at Sir John Golding, especially for me, for the past 22 years, has been a rewarding, fulfilling experience.
It is not just about administering medication or assisting with daily tasks. It's about bearing witness to the incredible resilience of human spirit. We are the catalyst of change, empowering our patients to reclaim their lives after often devastating injuries and illnesses. What truly sets us apart is our holistic approach to care. We don't just treat symptoms, we treat the whole person, meaning their mind, body, and spirit. We're actually architects of recovery. We rebuild lives. We work collaboratively with the interdisciplinary rehabilitation team to create individualized care plans that address each patient's specific needs and goals. Our nurses have championed group therapy sessions here, realizing the profound impact of peer support rather, in the recovery of this journey. We are problem solvers, consistently adapting our approach to overcome obstacles and maximizing each patient's potential. For example, during the COVID pandemic, when we had to send our patients home prematurely, the nurses initiated a telecare wound care system. You know what that is? They would have called the patients by video call and demonstrate to the patients how, or the patient's caregivers, how to do the wound care. And I'm telling you, within 3 months of that, when we reassess, the wounds were healing nicely and significantly. The wounds healed. So that is an innovation. That is what we are here at Surgeon. Perhaps most importantly, we are advocates, ensuring that our patients receive the resources and the support they need to thrive, both during their stay here at Surgeon and long after they have gone home. We envision a mobile rehabilitation clinic. That is where we do these things, because the need is greater than we can supply here at Surgeon. So we try to do that, and we have envisioned a mobile rehabilitation clinic that will bring vital therapy and support directly to the patients in their homes. Rehabilitation nursing is not always easy. I can tell you that I've been in it for 23 years. It demands patience, compassion, and unwavering dedication. But the rewards are immeasurable. To witness someone regain their ability to walk, to even move their toe. You know, I had a patient who called me as I arrived from vacation. She said, "Matron, come here. Guess what? I'm moving my toe." Wiggling that big toe was such a great achievement for her. When you see that, it moves your heart. Sometimes it's just a simple smile, to smile again after all they have been through. That is what makes this work profoundly fulfilling.
As a nurse, we are responsible for the 24/7 monitoring of our patients and their conditions. So we start from monitoring how their baths are given, dressing of their wounds, medications, nutrition. As you can see, where we serve quality nutrition to our patients, because nutrition is one of the most important things in the diet, in the overall well-being of our patients, in order to get them from the position of injury into integrating back into the society and having independence for themselves, right? So as you know, nursing is evidence-based, so we do evidence-based practice where we normally research on how to care for our patients. So we don't do anything that is hanged in the balance. It's always evidence-based, because this will be the outcome of if you do this way as opposed to doing it that way, right? And we also is a collaborative teamwork. So our patients here will have to go on the road. So we'll have to liaison with transport, we'll have to liaison with other institutions for them to get the care that they need. For example, x-rays, we go to the pharmacies, we go to other ultrasounds and all of those things. So being a nurse here is very fulfilling, in that we can see your patient coming in a position where they're not able to help themselves, to some of them walking out of here. And even if they don't walk, they're able to establish some level of independence.
While resources and specialized training, especially for nurses, can be challenging and it doesn't really exist in Jamaica to access in a developing context, the dedication and ingenuity of our nurses are key to driving positive outcomes and shaping a brighter future for our patients. This is a research-driven institution. Why I say that? We engage in research. We do presentations at research. We are asked to present our research as evidence-based in information to add to the body of knowledge that is already there. So our team here, included our nurses, are empowered with training across this continuum and operate in an evidence-based practice environment through research and networking with international rehabilitation nurses to ensure that we deliver safe and effective rehabilitation care. Here, nursing isn't just a job, it's a calling, a commitment to helping people rediscover their strength and rebuild their lives one step at a time. So the future of rehabilitation care at Jamaica's only rehabilitation hospital hinges on embracing technologies, expanding specialized services, and investing in training, especially specialized training for nurses, and fostering collaborative partnerships approach between healthcare professionals and individuals with disabilities to ensure comprehensive and personalized care pathways.
I've been here from September 2 months now. My experience here is good, because when I just come at the institution, I couldn't do much for myself, and since I've been here, I can do a lot more things. I have a spinal injury. I broke 2 bones in my neck, car accident. Treatment is good because the physio is good, the physiotherapist, the nurses are good, PCAs are good, doctors, porters, everybody. You just feel the love and the warm welcome,
I developed a stroke in April, and I was admitted here in early September, and it has been a very wonderful experience. The services offered in terms of physiotherapy has really helped me so far, and the care and attention of the nursing staff and the other staff has really been very good. They have really been very professional in their approach, and the camaraderie among them has really helped us to feel relaxed and welcome here. Well, I think they need more recognition because the job that they have been doing over the years have been tremendous, helping so many persons, because as you know, stroke has become very, very common in Jamaica, and so a facility like this is really, really making an impact on the wider society.
So we have inpatient capacity of 60. Presently we have 20 males, 8 female beds. We also have 30 pediatric beds, but we have not had many children in the past couple of years, which may be a good reflection on the Jamaican society, because at one stage we had quite a few children. The children that we have are here for rehabilitation for head injury, a few spinal cord injuries, about one or two per year sustained gunshot injuries, unfortunately, to the spine. We also have currently have a few cerebral palsy patients, but we don't have as many children as we used to. For outpatients, we see on average about 200 patients per month. That's between the clinic and the physiotherapy services. Getting a spinal cord injury or losing a limb is life-changing. And so it affects everybody in the family when a member is admitted to the institution or requires the services of the institution. We have, for patients with spinal cord injuries, we have family conferences at the beginning of the admission so that we discuss expectations of the patient for improvement or expectations, what to expect from the family in terms of support, what to expect in terms of what the patient will be able to do within the limitations of the disability that the patient has. And by including the family, we get them to be on board from the beginning so that they're aware of what is happening, they're aware of what to expect, they know how to prevent complications and how to manage their loved one when they get back home. Because the essence of rehabilitation is to get the person back into society to function as best as possible. But it brings out the real humans in every single way.
Oh, we restore hope to patients, because when you have a spinal cord injury or a stroke, you can lose hope very easily. So we help to restore hope and we build awareness. So you have to make the patients and the family understand what it is to have a spinal cord injury or a stroke or any other neurological disability. And so we help the patients to understand. We help families to care for these patients, because some patients will be very independent when they go home, but some will not be independent. And so the dependent ones, we have to help the families to learn how to care for them at home. And, in other words, caregiver burden, to understand how to cope with caring for somebody with a disability. For those who are independent, they can return to work or they can even live on their own. We can't guarantee that every patient who will leave here will walk again. But for those who will not, it's certainly to learn to be independent in their wheelchair and to move around and to do everything. One major success story I will speak about is Keith Tucker. I came here in 1996 and he was probably one of my first patients that I met, and I remember wondering, what in the world am I going to do with this gentleman, because he had a high spinal cord injury. But in spinal cord terms, we'll say he was an incomplete injury, meaning that his level was high, but he had function in different parts of his body. So after rehab, the question was, where was he going to go? Right? Because he had some function, but not enough to be independent and live on his own. And he kept saying to me, don't worry about it, God will work it out. And he lived in a nursing home, and he still lives in a nursing home. He's fully cared for.
Patients who are admitted to the Surgeon Golden Rehabilitation Centre will tell you that they look forward to entrance into this institution.
Fulfilling its core purpose, the Surgeon Golden Rehabilitation Centre also features a state-of-art limb facility, Surgex, specializing in the design and construction of high-quality prosthetic limbs and personalized care, while empowering patients to overcome physical challenges and embrace new possibilities.
Compared to what a prosthetic costs overseas, the cost is relatively, it's a lot less, but it's still expensive for the average Jamaican. So a below knee prosthetic we're looking at around 600,000 Jamaican for below knee prosthetic. And yes, there is the company Surgex that provides a prosthetic. They do have a payment plan that they have. The government has assisted through the New Limb, New Life program, where they put up, I think it was $50 million last year, to assist persons who need a prosthetic. and the Jamaica Council for Persons with Disabilities, they too have an assistance program. So there are ways to get assistance for the prosthetic. We would love for insurance companies to have prosthetics and other devices as part of their insurance coverage, because I mean, if you can get medication with insurance, you should be able to get a prosthetic limb with insurance. So that policy, I think, needs to be revised if we say that that we want to be disabled friendly for 2030. I think that aspect needs to be looked at as a government.
This is the wrap-on measure process. We begin with a patient we are preparing for a prosthetic leg. So we wrap to shrink and shape the stump so that we get a cone shape, right? So that it will be perfectly fitted into the prosthesis. For the measurement, we're going to go out in length, 4 centimeters. After which, the measurement that we got here, we document them, keep them recorded. Then after 4, we get the measurement for 4, we go to 6. So each time we do the measurement, it is to see how much it shrink each time the patient come back, right? So after 6 centimeters, so we go 4, 6, 8, 10. 4 centimeters, 6 centimeters, 8 centimeters, 10 centimeters. Now I don't have to use a piece of tape to hold this because this has the adhesive in it that holds itself. This is the one that does the shrinking. So same way I wrap the crepe bandage, the same way I wrap the cohesive bandage.
Surgix came in quite recent, before COVID. Surgix, which is a private entity, they came in to assist because Monex was having difficulties sourcing materials and providing the prosthetics for patients. So the prosthetic services, still a private entity, but patients are assessed here because we have the ability to determine if a patient can use a prosthetic or not, because not everyone who has an amputation can be fitted with a prosthetic. And it will all depend on what the patient was like before. Because if the patient was very active, they will even send a video to show that you can't even tell that they're wearing a prosthetic leg, because they can dance, they can run, they can function just like before. The way the limbs are done. When the patient has an amputation, the limb may not be ready in terms of it may be still a bit swollen and things like that. So there's a process of molding, there's a process of strengthening. So physiotherapists are involved even before the prosthetic. So they teach a patient how to move the stump, how to put pressure on it, because they're going to have to put their weight on it when the prosthetic is fitted. As the slogan says, it's new limb, new life.
And new possibilities. Committed to empowering patients through rehabilitation, education, and opportunity. A key part of this mission is the MONEX, a dedicated initiative designed to provide meaningful job training and employment opportunities, fostering skills development and independence. MONEX helps individuals build a brighter and more self-sufficient future.
According to the Constitution of Surgeon, both companies supposed to operate under the same umbrella. According to the late founder, Surgeon, in his book, History of the Mona Rehabilitation Centre, he states very clearly that unless you can provide meaningful employment for the physically challenged, they're going to sink into depression and whereby reverse the good work of rehabilitation. So then MONEX, that's where MONEX come in to really provide meaningful employment for the physically challenged. So I work alongside MONEX to also provide job and training for the physically challenged. Well, primarily it's a printry. right? And we do, it's on the money we don't do what prestigious, right? We do books repair, general printing, promotional items, you know, and what I do, I like taking past patients will come, keep them for a period of time, train them, and then those who live in the area, after they go home, I would send the work to them, pick it up back and pay them, so it go on like that.
The Surgeon Rehabilitation Centre stands stronger through collaborations by partnering with leading hospitals and specialized care centers locally and internationally to provide patients with access to world-class expertise, innovative treatments, and holistic support, all while redefining the path to recovery.
We collaborate with Montefiore team in New York, Montefiore Hospital. They send a rehab team here every July. It consisting of physiotherapists, occupational therapists, rehab medicine specialists, and they work with us to do education and help us where our patients, with patients, especially the occupational therapists. We also collaborate with the University of the West Indies for students who are assigned here. So the School of Physical Therapy assigns students here at least twice, maybe 3 times a year. Social work students are assigned, nursing students are assigned, and doctors come every Tuesday and Thursday. That's a more recent event in terms of assigning doctors to come down, students rather, to come down here and understand about rehabilitation. We also collaborate with the University Hospital of the West Indies through programs such as surgeries that are done, or to get the help of the physical medicine and rehab specialists there to support our patients. So we will refer patients there if needs be.
Surgeon Golding Rehab Centre is a caring facility where our patients, they feel understood, going through that serious loss, losing the ability to walk or even to lose the ability to use their hands. So our staff is very caring. We assist them in what they are unable to do, and we care about their ability to resume normal function when they go back out in society. And we also try to get the public to accept them as valuable members of society and don't think of them as beggars on the sidewalk, where you see them and you drop coins in their hands and so on. They are people who can work and can contribute to society.
With plans to expand, the center is preparing to do more, creating new spaces, new opportunities, and a stronger foundation for rehabilitation and hope.
We are now actually in the process of looking to expand to actually build a complete separate wing with 30 new beds, operating suites, because the services are needed. Currently, we have patients who are waiting on sometimes for months because the beds that we have are limited.
On the wards, they will have, and we have it in physiotherapy too, Hoyer lifts, which helps us to transfer the patients from the bed to the chair or back. There's scales if you need to weigh a patient. You actually have wheelchair scales where the patient can go on the scale to be weighed. In physiotherapy, we have major equipment such as wheelchair accessible multi-gym. That, of course, is to help with the strengthening for the muscles. And we have parallel bars where the patients can stand up and walk. And more recently, we have a hoist that the patients can be hooked up on and help to walk in the parallel bars if they cannot manage to walk by themselves. And we have a tilt table, which helps patients with getting over any challenges like what we call postural hypotension, just if they have issues with blacking out and they can't manage, or to just weight bear through their feet, because of course one of the challenges is that they're not able to put weights through their legs. So those are some of the major equipment that we have here.
Some of the services we offer here include individual therapy, group therapy. We also see families and couples where that is necessary. We're also involved in patient development and enrichment activities. There are other types of activities that are group-based, such as discharge preparation, which focuses on our patients leaving the hospital and readjusting to their home environment and reintegrating into the community. We also have experiential sessions, which constitute a part of education and training and is geared towards staff interaction with our patients here. So some of the experiences that our patients tend to have, first and foremost, is a sense of relief. They feel that they are understood, and for many of them, it's the first time that they have been fully heard. They typically feel that persons don't truly get what has happened to them, and they don't fully appreciate the trauma and the grief and loss that they go through. They also tend to get a new perspective of the challenges that they're facing given the physical alterations they have in their bodies. They leave being better able to cope, adapt, and adjust not only to the disability, but also to the consequences of what has happened to them. As we look to the future, counseling is an essential service. Take, for example, when we go on home visits. Quite often when we meet our caregivers or our patients at home, the setting is different, and so intervention at home within that space may be required. Here at Sir John, we have been pursuing a mobile unit so that we can offer more community-based care for our patients. If we were to get that sorted out and a counselor is a part of the team that is going out into the community, then the reach can be much wider. Counseling also helps with the improvement of communication between the patient and their family members, patients and their caregivers, patients and their children, patients and spaces within the community in which they usually interact. We treat with the whole person here, and so a patient may be uncomfortable returning to work. They may be uncomfortable going to church because of the changes in their bodies. And so as they go through the counseling process, some of these areas that require adjustment become easier over time and become more palatable, not just for the patient that we're treating with, but their family members as well.
The Sir John Golding Rehabilitation Centre. It's more than just a place for recovery. This center symbolizes courage, resilience, compassion, strength, and possibilities.
Supporting the institution will be you supporting the people of Jamaica. Many persons who have entered this facility never knew that they would have needed the service of this institution. But luckily, the institution have been here for many years and have evolved in providing human service. So we're looking to you, Jamaica, to support us in achieving these goals so that we can further care for the people of our country. Thank you.
The Sir John Golding Rehabilitation Centre remains a beacon of hope, healing, and perseverance. Built on a legacy of care, it continues to evolve, embracing innovation, expanding partnerships, and empowering lives. With a continued commitment to care, compassion, and excellence, the journey forward promises even greater possibilities for those in need. The Sir John Golding Rehabilitation Centre, where each individual's physical, emotional, social, and spiritual well-being is nurtured, empowering them to reach their optimum potential.